Okay, so here is your ICD-10 code book. This is the 2018 edition because, yes, it does come out every year, but that does not mean that this changes to 10, 11, or 12. This stays ICD-10. It's just if there is any change to description as far as the terminology or the wording, the font, or updates to actual diagnosis codes or adding diagnosis codes such as COVID, like I just explained in lecture. Okay, so pretty thick book, as you can see, pretty thick. The gray area is your alphabetical index, is where we start anytime we're looking for a code. We start here with the words that we have in our superbill or in counterform. Then the tabular list are all your chapters, starting these are your external cause injuries, so let me bypass that real quick. Starting with chapter 1. Okay, this is your tabular list. Chapter 1 would be our certain infectious and parasitic diseases. Okay, in the front of the book gives you a breakdown of the contents. So part 1 is just your guidelines for coding and reporting your coding. Part 2 is your alphabetic index. It's where we look to see, it's where we start to find our diagnosis code, okay? And then part 3 is the tabular list of diseases and injuries based on the body system. So you can see here, chapter 1 is your infectious and parasitic diseases. Chapter 2 is neoplasms. Chapter 3 is disease of blood and blood forming organs and other disorders involving the immune system. 4 is endocrine, nutritional, metabolic diseases. 5 is mental, behavioral, and neurodevelopmental disorders. 6 is diseases of the nervous system. That would include the brain. 7 is diseases of the eye and adnexa. 8 is the ear and mastoid process, because mastoid is your bone of your ear. 9 is your diseases of circulatory system. 10 is respiratory. 11 is digestive, 12 is skin and subcutaneous tissue, so the tissue underneath the first layer of the skin. 13 is your musculoskeletal system and connective tissue. 14 is your genitourinary system, so that's kind of like your urinary system and your genitals or your reproductive system kind of combined together. 15 is pregnancy, childbirth, and puerperium. 16 is certain conditions originating in the perinatal period, okay? Congenital malformations, deformations, and chromosomal abnormalities is chapter 17. 18 are your symptoms, signs, and abnormal clinical and laboratory findings not elsewhere classified, would be 18. 19, injury, poisoning, and certain other consequences of external causes, not to be confused with your external causes of morbidity and mortality, which is chapter 20. The last chapter, 21, is your health status codes, which are your Z codes. All right, so I'm going to give an example where you're just going to use hyperlipidemia. So if I want to know the code for hyperlipidemia, I'm going to start in my alphabetic index. I'm going to go to the H's. You can easily find the alphabet by using the end of the tab here of the book. Go to the H's, open that up. Now we're looking for hyperlipidemia. Everything is alphabetized. You have here it starts the first letter on this side of the book, and then over here is the last word, or starts the first word, I should say. And here is the last word at the bottom of this page, or okay. It is very similar to like if you were looking up a word in your dictionary or your thesaurus or something like that. Okay. So hyperlipidemia. We're going to just look for that real quick. Hyperfunction. Over here on this side of the page is the first word. And then the last word on the other page is hypertension. So it's going to be in here somewhere. Okay, so hyperglycemia, hyperkalemia. We're getting a little closer, and as you see here, we have hyperlipidemia, and it says comma hyperlipidemia. It says E78.5, combined E78.2, familial Then you have group hyperlipidemia, mixed hyperlipidemia, and then you have specified, not elsewhere classified. It has some codes. So if I was looking for mixed hyperlipidemia, I could be pretty confident that that's the code, but I want to be sure. Okay, so I'm going to look up, these are your words, these are your indentations. I'm going to go to E78.2 by going to my tabular list. My E's are going to be chapter 4. Sorry for the dogs barking. And we said E78.2. So here is E74 coming down to E75. Okay, so E78, here is E76, here's E78. So E78 says disorders of lipoprotein metabolism and other lipidemias. Okay, just says lipidemias, it doesn't say hyper, so we need to keep going. E78.0 says pure hypercholesterolemia, not what we're looking for. This is high cholesterol, not lipids. Lipids are different than cholesterol, okay? Then here we have pure hyperglyceridemia. And then here's our E78.2, mixed hyperlipidemia. And if you look at all these indentations, you can get more specified or specificity. And if any of this matches what's in the patient's chart, then you can confirm that that's the code you would use. And in this case, that's the code I would use. Okay, so as a general rule, basically how you use this book is you always start in the alphabetical index, find your diagnosis term here, then whatever code it tells you it possibly is, always confirm it by going to that code according to the chapters. And the letters of the codes are in the parentheses here. Oops, sorry. So chapter 9 is I00 to I99, okay? And as we said, chapter 4, where your E codes 00 to E code 99. So hopefully this makes a little bit more sense to you guys as we're going through it. And like I said, you'll get some hands-on when we get back on campus.